The 3 mandatory tests to refuse after 70, a doctor explains. Hello, my friends, an internal medicine physician and a specialist in geriatric health. Today, we are embarking on a discussion that is not only critically important and potentially life-saving, but also, frankly, quite controversial. We will be examining 3 medical tests that your doctor will likely insist are mandatory for you after you reach the age of 70. However, mounting medical evidence increasingly suggests that these very tests may inflict more harm than good upon healthy seniors. I believe it is high time to illuminate this crucial medical information, armed with scientific evidence that the medical establishment often prefers not to discuss openly, primarily because these tests generate billions of dollars in revenue. When we gain a thorough understanding of what research truly indicates regarding screening tests for seniors over the age of 70, we not only avoid unnecessary procedures, but also prevent serious complications and, most importantly, shift our focus towards interventions that genuinely enhance quality of life and promote longevity. So, I welcome you back to this space where patient-centered medicine takes precedence over profit-driven protocols, and where evidence-based care replaces automatic testing that might do more harm than good. Whether you are approaching your 7th decade, have already surpassed it, or are actively caring for elderly parents, the information I am about to share could quite literally save your life or the life of a loved one. For 28 years in my extensive practice of geriatric medicine, I have observed an uncomfortable truth that I feel compelled to share. There are 3 specific tests that physicians routinely order for patients aged 70 and above, with the claim that they are mandatory for maintaining good health. However, major medical organizations have in fact quietly revised their recommendations, acknowledging that these tests frequently lead to overdiagnosis, overtreatment, and significant complications in elderly patients who might have otherwise lived longer, healthier lives had they never undergone these screenings. Let me paint a picture of a scenario I witness constantly in my practice, a situation that truly breaks my heart because I am acutely aware of the harm that is about to unfold. Imagine this: a 73-year-old patient, feeling perfectly well, active, and completely symptom-free, approaches their doctor. Yet their physician insists that they must undergo a colonoscopy, aggressive cancer screening, and a cardiac stress test, proclaiming these procedures as mandatory for their age. The patient, having heard disquieting stories about seniors experiencing complications from these very procedures, becomes understandably confused. They feel fine, so why the insistence on these tests? Are they missing something? Is there crucial information about the risk versus benefit calculation at their age that their doctor is not disclosing? This is the precise question that arises from healthy seniors who, with their innate intuition, sense that aggressive testing when they feel perfectly healthy might be misguided. This concern is echoed in consultations where families strive to shield their elderly loved ones from unnecessary medical interventions, reflecting a growing awareness that more medical care does not invariably equate to better care, especially for individuals over the age of 70. I urge you to remain engaged throughout this entire medical revelation. By the time we conclude, you will be equipped with knowledge that can safeguard you from procedures whose risks, according to mounting medical evidence, often outweigh their benefits in healthy seniors. This information has the potential to add years of quality life by helping you avoid complications stemming from tests you never truly needed. Let us delve into the medical reality that very few physicians are willing to discuss with their elderly patients in an honest and transparent manner. Medical screening tests are meticulously designed for populations where the anticipated benefits demonstrably surpass the potential risks. However, this risk-benefit calculation undergoes a dramatic transformation after the age of 70. Your life expectancy, the natural progression of diseases, and your body's capacity to tolerate medical procedures all shift fundamentally during this stage of life. As with all facets of geriatric medicine, a nuanced understanding of risks, benefits, and individual circumstances is absolutely paramount. Generic protocols that are perfectly suitable for a 50-year-old can often be actively detrimental when applied to a healthy 75-year-old. Yet, the prevailing practice among many doctors is to continue ordering these tests automatically, without engaging in an honest dialogue about whether these interventions will genuinely contribute to a longer or better life for their patients. Therefore, let us begin by exploring the fundamental medical principles at play. What are these 3 tests that are routinely presented as mandatory after the age of 70? Why is the medical evidence increasingly questioning their value, particularly for healthy seniors? What are the real risks that physicians often downplay or entirely disregard? And most critically, how can you, as a patient, initiate an informed conversation with your doctor to determine if these tests are genuinely necessary for your specific situation, or if declining them might in fact be the healthier choice? Let us commence with the first of the 3 mandatory tests that, in my professional opinion, most healthy seniors over 70 should seriously consider declining: routine colonoscopy screening after the age of 75. This is a procedure that, regrettably, leads to a significant number of complications in elderly patients, while offering minimal benefit. The U.S. Preventive Services Task Force, a highly respected body, now explicitly recommends against routine colonoscopy screening after age 75 for individuals who have a history of normal previous screenings. So, why do physicians still push for it? The simple answer, unfortunately, lies in profitability. Each colonoscopy procedure generates between $3,000 and $5,000 in revenue for the medical system. Gastroenterologists, consequently, possess strong financial incentives to continue screening elderly patients, even when the current medical evidence strongly suggests they should not. The hidden risks, which are often not fully disclosed to patients, are substantial. After the age of 70, your susceptibility to serious complications from a colonoscopy increases dramatically. For instance, bowel perforation, a life-threatening event, occurs in approximately 1 in 300 procedures for seniors, compared to about 1 in 1,000 for younger individuals, frequently necessitating emergency surgery. Furthermore, cardiovascular complications arising from the sedation used during the procedure increase significantly. The bowel preparation itself, a crucial but often unpleasant part of the process, can lead to dangerous dehydration and electrolyte imbalances. These imbalances can, in turn, trigger heart problems or lead to debilitating falls. What the research unequivocally demonstrates is compelling. A landmark study published in JAMA Internal Medicine meticulously followed over 50,000 seniors aged 75 and older for a period of 10 years. The findings revealed that those who continued with routine colonoscopy screenings exhibited no improvement in colon cancer mortality rates when compared to those who opted to cease their screenings. However, the screened group experienced significantly higher rates of hospitalization due to complications directly arising from the procedures themselves. Herein lies the stark medical reality. Colon cancer is a slow-growing disease. If you are 75 years old and had a normal colonoscopy at age 65, any polyp that might have developed in the interim would likely take an estimated 10 to 15 years to progress to a dangerous cancerous stage. Statistically speaking, you are far more likely to succumb to heart disease, stroke, or other causes of mortality before that slow-growing polyp ever poses a genuine threat to your life. Meanwhile, the colonoscopy procedure itself carries immediate and tangible risks of serious complications. The sole exception to this recommendation would be if you are experiencing symptoms such as bleeding, significant changes in bowel habits, or unexplained weight loss. In such cases, a diagnostic colonoscopy may indeed be appropriate. However, for routine screening in an individual who feels perfectly healthy, the overwhelming weight of evidence increasingly argues against its necessity after the age of 75. Moving on to our second mandatory test, which I believe is perhaps the most controversial, aggressive prostate cancer screening using PSA, prostate-specific antigen tests after the age of 70. We now possess definitive evidence that this screening practice leads to massive overdiagnosis and overtreatment of cancers that would never have caused a problem in a man's lifetime. So why do doctors continue to push it? The PSA test is quick, easy to administer, and generates substantial follow-up revenue through subsequent biopsies, surgeries, and radiation treatments. It has become so ingrained in routine medical practice that many physicians order it automatically without adequately discussing whether it actually provides any benefit to the patient. The hidden truth about prostate cancer is that the vast majority of men over the age of 70 have some prostate cancer cells present. Autopsy studies reveal that a staggering 60% to 70% of men who died from unrelated causes had prostate cancer that they were entirely unaware of because it was growing so slowly that it never manifested any symptoms. These are cancers that would have never threatened their lives. What the research unequivocally demonstrates is the impact of large-scale studies like the European randomized study of screening for prostate cancer. This study followed 162,000 men for 13 years. The crucial finding for men over 70 was that PSA screening did not reduce deaths from prostate cancer. However, it did lead to a monumental increase in the number of biopsies performed, surgeries undertaken, and radiation treatments administered. Each of these interventions carries serious side effects, including incontinence and impotence. Here's what they often fail to tell you. When you undergo a PSA test after age 70 and it comes back elevated, you will likely be pressured into a prostate biopsy. This biopsy itself carries a 2% to 3% risk of a life-threatening infection, a risk that is even higher in elderly men. If the biopsy detects cancer, which it frequently will given the high prevalence of prostate cancer in older men, you will then be pressured into treatment even though the cancer would very likely never have threatened your life. The consequences can be devastating. I have personally witnessed dozens of healthy 75-year-old men who felt great, had a PSA test, were diagnosed with cancer, underwent surgery or radiation, and subsequently experienced permanent incontinence and sexual dysfunction. All of this occurred in an effort to treat a cancer that would almost certainly have left them undisturbed during their remaining 10 to 15 years of life. The medical consensus is evolving rapidly on this issue. Major organizations such as the American Cancer Society, the U.S. Preventive Services Task Force, and the American Urological Association now all recommend against routine PSA screening after the age of 70. Unless a patient has a strong family history of prostate cancer or is experiencing concerning symptoms. Finally, let us address the third test, often presented as mandatory, aggressive cardiac stress testing in asymptomatic seniors. This is the test that doctors employ to evaluate your heart's function even when you are experiencing no chest pain, shortness of breath, or any other discernible cardiac symptoms. While this may sound prudent on the surface, for healthy seniors, it frequently initiates a cascade of unnecessary and potentially harmful interventions. So, why do doctors continue to push for it? Stress tests are a gateway to highly profitable follow-up procedures, including cardiac catheterizations, stent placements, and bypass surgeries, which collectively generate hundreds of thousands of dollars in revenue. Cardiologists, understandably, possess strong financial incentives to identify problems that necessitate intervention. The hidden dangers are significant. The stress test itself can in fact trigger heart attacks in elderly patients. The very nature of the test is to push your heart to its maximum capacity, which can be dangerous for a compromised cardiovascular system. Moreover, false positive results are extremely common. Studies indicate that 40% to 50% of abnormal stress tests in seniors turn out to be normal when a subsequent cardiac catheterization is performed. This leads to unnecessary invasive procedures, each carrying its own inherent risks. What the research conclusively demonstrates is reflected in a study published in the Journal of the American Medical Association Cardiology. This study followed 10,000 seniors who had no cardiac symptoms. The findings revealed that those who underwent routine stress testing did not experience better cardiac outcomes compared to those who did not. However, the screened group did exhibit significantly higher rates of complications arising from the follow-up procedures that the stress tests had triggered. the cascade of harm often unfolds in a predictable pattern. A 73-year-old individual feeling perfectly well undergoes a stress test simply for a precautionary checkup. The test reveals an abnormality. They are then promptly scheduled for a cardiac catheterization. During this procedure, a 40% blockage might be identified, a blockage that would, in all likelihood, never have caused any problems. To err on the side of caution, a stent is placed, and the individual is placed on lifelong blood-thinning medication, increasing their risk of bleeding complications. All of this is a consequence of a screening test that was never truly needed. The medical reality is this: if you are experiencing symptoms such as chest pain, shortness of breath, or unusual fatigue, then stress testing can indeed be an appropriate diagnostic tool. However, screening healthy asymptomatic seniors often leads to the overdiagnosis of conditions that do not require intervention and exposes individuals to serious procedural risks. Let me share a specific anecdote that effectively illustrates all three of these issues. A patient named Margaret presented to me at the age of 76. She was active, healthy, completely symptom-free, and felt remarkably well. Her previous physician had scheduled her for a colonoscopy, a PSA test for her husband, and a cardiac stress test, all of which were presented as mandatory components of preventive care. I took the time to review the existing medical evidence with both Margaret and her husband. We discussed how, given their age and the absence of symptoms, coupled with a history of normal previous screenings, these tests were far more likely to uncover findings that would lead to risky treatments rather than actually extending their healthy lifespans. After careful consideration, they made the informed decision to decline all three tests. Instead, they chose to focus their energy and medical attention on interventions that demonstrably improve healthy longevity after the age of 70. Their new regimen included daily walking, strength training twice a week, adherence to a Mediterranean diet, consistent social engagement, and diligent management of their blood pressure and cholesterol with appropriate medications. 5 years later, at the age of 81, Margaret remains active, healthy, and is thriving. In stark contrast, 3 of her friends who did undergo those mandatory tests subsequently experienced serious complications. One was hospitalized for a perforated bowel due to the colonoscopy. Another developed permanent incontinence following treatment for prostate cancer. And a third ended up on blood thinners after receiving a stent that was ultimately unnecessary. This story is not an isolated incident. I have witnessed this pattern hundreds of times. Healthy seniors who elect to forego aggressive screening often enjoy longer, healthier lives than those who readily submit to every test their doctors recommend. The evidence supporting the refusal of these tests in healthy seniors is robust and multifaceted. Firstly, a comprehensive analysis published in JAMA found that for seniors over 75 who are asymptomatic and have a history of normal previous screenings, routine colonoscopy, PSA testing, and cardiac screening provided no discernible improvement in mortality rates, but were associated with significant increases in procedure-related complications. Secondly, the Choosing Wisely campaign, a commendable initiative supported by dozens of medical specialty societies, explicitly advises against these specific screening tests in elderly patients who are not experiencing symptoms. This campaign rightly categorizes them as examples of low-value care that not only wastes precious resources but also actively harms patients. Thirdly, international comparisons provide compelling evidence. Countries that adopt a less aggressive approach to screening elderly patients, such as the United Kingdom, often demonstrate similar or even superior health outcomes for their senior populations compared to the United States, where aggressive screening has become the norm. Therefore, it is crucial that you, as a patient, are empowered to ask pertinent questions before agreeing to any screening test after the age of 70. Here are some critical questions you should pose to your doctor. Question number 1. Considering my current age and overall health status, what is the actual probability that this test will detect something that will genuinely threaten my life in the remaining years of my life? Physicians often neglect to provide this vital context, leaving patients uninformed about the true statistical likelihood of a significant finding. Question number 2. What are the specific risks of complications associated with this test and any subsequent procedures it might necessitate? I strongly encourage you to press your doctor for quantifiable numbers rather than vague reassurances. Question number 3. If something is found, what specific actions would we take differently based on the results? Would discovering an abnormality genuinely alter my treatment plan in a way that demonstrably improves my quality of life or extends my lifespan? In many instances, the honest answer to this question is no. Question number 4. What do the major medical organizations officially recommend regarding this particular screening test for individuals in my age group? It is important to note that many physicians unfortunately overlook or disregard updated guidelines that explicitly advise against routine screening for specific age demographics. My professional medical recommendation for healthy seniors over 70 is to redirect your energy and focus your medical care towards interventions that are proven to enhance healthy longevity. This includes prioritizing regular exercise, maintaining a nutritious diet, fostering strong social connections, and ensuring the effective management of any existing medical conditions through prescribed medications, rather than engaging in a relentless search for problems. Through aggressive screening tests that often generate more harm than benefit, this advocacy for a more selective approach does not in any way imply ignoring symptoms or refusing all medical care. Rather, it advocates for being informed, discerning, and placing a higher value on quality of life over the sheer quantity of medical interventions. The undeniable reality is that after the age of 70, a less aggressive medical approach frequently leads to longer, healthier, and more comfortable lives compared to the pervasive test everything, treat everything philosophy that has become the standard of care. Before we conclude, I want to touch upon something of great importance for seniors who are proactively taking control of their health by declining unnecessary tests, but who also wish to ensure they are optimally supporting their bodies to maintain the health and vitality that makes such decisions the right ones. Maintaining optimal health naturally, thereby enabling you to avoid unnecessary medical interventions, fundamentally requires supporting your body's core systems. This includes robust cardiovascular health, a well-functioning immune system, sustained energy levels, and overall vitality. It is precisely for this reason that I often recommend 2 natural support options that effectively assist seniors in maintaining the robust health that renders aggressive screening unnecessary. For those seniors seeking gentle yet effective support for their cardiovascular health and overall well-being, I recommend organic watermelon extract. This natural extract is rich in L-citrulline, a compound that supports healthy blood pressure, naturally enhances circulation, and contributes to maintaining the cardiovascular health that can make aggressive cardiac testing redundant. However, if your goal is comprehensive health optimization, extending beyond just cardiovascular support to include enhanced immune function, sustained energy levels, and the overall vitality that empowers you to thrive without the necessity of aggressive medical interventions, then I highly recommend the Senior Vitality Formula. This carefully crafted formula synergistically combines Uricoma longifolia Jack, commonly known as Tongkat Ali, for supporting healthy hormone levels essential for vitality, fenugreek for promoting metabolic health and sustained energy, nettle root for supporting prostate health and overall wellness, and concentrated L-citrulline for ensuring optimal cardiovascular function and circulation. Collectively, these potent ingredients work to bolster the robust health that allows you to confidently decline unnecessary screening tests, secure in the knowledge that your body is functioning at its peak through natural support rather than aggressive medical interventions. You will find direct links to both of these recommended options in the pinned comment and the video description below this presentation. Take charge of your medical care by refusing tests that inflict more harm than good. Because truly, healthy aging after 70 is achieved by naturally supporting your body and assiduously avoiding the cascade of complications that too often follows aggressive, unnecessary screening. For any persistent symptoms you may experience, always consult with a qualified healthcare professional.